Welcome to Evergreen Family Medicine. Today we are with Kim Stevens, family nurse practitioner. She is from the Myrtle Creek Clinic. Thank you for spending some time with us today.
Thank you for having me.
Absolutely. We always like to get to know the providers at Evergreen. So tell us a little bit about yourself.
So I went to school in Pittsburgh, Pennsylvania for my bachelor's at Duquesne University. From there, I worked as a registered nurse for quite a few years, about 10 years, and went back to school at Simmons University to get my master's as a nurse practitioner in family practice. And from there, I've actually worked in Roseburg since. So I've been local for quite a while now.
Where are you originally from?
So Pennsylvania, Pittsburgh area, I would say, but I've always floated around, even from childhood, moving with my family and then afterwards.
And it sounds like your career has taken you to a lot of different cities.
It has. I had the pleasure of being a traveling nurse, and they essentially paid me to work 3 months in major university hospitals all over the United States. So I've touched base in quite a few major cities, if not most of them.
So how did you find your way to Roseburg, and how did you find your way to Evergreen?
Okay, so I found myself in Roseburg actually through Umpqua Health Alliance. They reached out to me as I was getting ready to graduate from Simmons University. I did graduate in the top 10 of my class and with honors, and I think that they took notice because of that. So they recruited me here, and I ended up at Evergreen just, from knowing other providers in the community, word of mouth. I have a few people that I have personal relationships outside of work with that work here and just absolutely adore it. So I had to find out what that was all about, essentially.
So in your time at Evergreen then, what are your impressions?
It is, so the thing that means the most to me is it is very evident that there is patient-centered care. Patients are our focus. And for me, that is a big priority for any place that I work in. Working in healthcare, it should be patient-focused. So I really, really appreciate that about Evergreen in general. It aligns with my beliefs and ethics for patient care.
And you are now in Myrtle Creek, Oregon, which might be the opposite of some of the big cities that you spent some time in. How do you enjoy being in such a small town?
So I actually like it. Before I moved to the Myrtle Creek Clinic for Evergreen, I worked in a different family practice clinic in Myrtle Creek. So one of the beautiful things is that those patients that have been with me for 4 or 5 years now and in that area were able to follow me. And Evergreen allowed that to happen too, which is amazing because patient care, again, is so important, and I did not want to leave my patients.
Which is part of the reason why you would want to practice in a rural place.
Yes.
And grow in the community and all of those kinds of things.
Yeah, absolutely.
Yeah.
Yeah. No, I really am enjoying it there, and I'm learning and growing with time, as typical anytime you work in a new environment.
Yeah. Well, welcome to Evergreen. Thank you for your time.
Thank you, Brian.
That's Kim Stevens. She's a family nurse practitioner at the Myrtle Creek Clinic for Evergreen Family Medicine. You can find out more about all the providers at Evergreen at evergreenfamilymedicine.com and follow Evergreen online on Twitter, Facebook, YouTube, and Instagram.